In this video, I will try to answer frequently asked questions about the CATAFLAM medication. If the video is helpful for you, don't forget to like the video and subscribe to the channel to support me. What is CATAFLAM and why is it used? CATAFLAM is used to reduce pain, inflammation, and fever. It is prescribed especially to alleviate symptoms of inflammatory joint diseases such as rheumatoid arthritis, osteoarthritis, ankylosing spondylitis. Additionally, it can be used in the treatment of conditions like menstrual cramps, toothaches, and headaches. How to use CATAFLAM? Read the medication guide provided by your pharmacist before you start taking Diclofenac and each time you get a refill. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually 2-4 times a day. Take this medication with a full glass of water unless your doctor directs you otherwise. Do not lie down for at least 10 minutes after taking this medication. Stomach upset occurs while taking this medication. Take it with food, milk, or an antacid. There are different brands and forms of this medication available. Because different forms do not have the same effects at equal strengths, do not switch forms of Diclofenac unless your doctor tells you to. The dosage is based on your medical condition, response to treatment, and other medications you may be taking. To reduce your risk of stomach bleeding and other side effects, take this medication at the lowest effective dose for the shortest possible time. For certain conditions, it may take up to 2 weeks of taking this drug regularly until you get the full benefit. Here's what you need to know before using CATAFLAM. This product may contain inactive ingredients that can cause allergic reactions or other problems. Consult your doctor for more details. This medication may make you dizzy, drowsy, or cause blurred vision. Therefore, caution should be exercised in activities that require alertness while using this medication. This medicine may cause stomach bleeding. Daily use of alcohol and tobacco, especially when combined with this medicine, may increase your risk for stomach bleeding. Limit alcohol and stop smoking. This medication may make you more sensitive to the sun. Limit your time in the sun. Avoid tanning booths and sun lamps. Before having surgery, tell your doctor or dentist about all the products you use. Older adults may be at greater risk for stomach intestinal bleeding, kidney problems, heart attack, and stroke while using this drug. Before using this medication, women of childbearing age should talk with their doctor about the benefits and risks. Tell your doctor if you are pregnant or if you plan to become pregnant. This medication may harm an unborn baby and cause problems with normal labor delivery. It is not recommended for use in pregnancy from 20 weeks until delivery. If your doctor decides that you need to use this medication between 20 and 30 weeks of pregnancy, you should use the lowest effective dose for the shortest possible time. You should not use this medication after 30 weeks of pregnancy. Possible side effects that may occur with the use of CATAFLAM are upset stomach, nausea, heartburn, diarrhea, constipation, gas, headache, drowsiness, dizziness, or blurred vision may occur. If any of these effects last or get worse, tell your doctor or pharmacist promptly. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. If this video was useful for you, like the video and subscribe to the channel. Share your opinions and experiences about medication use in the comments section. I wish you healthy days.